as new agents have become available for adults with relapsed refractory B-cell ALL, there have been efforts to try to improve the outcomes that are seen thus far, which have been really focused on single agent activity. So CAR T cells, blinatumomab, inotuzumab, ozogamicin, currently approved only as single agents. There have been some studies that have started to look at combinations, either with chemotherapy or other agents, to try to improve on the outcomes that we've seen so far. And while those have been important works, it's unclear how much that those additional agents are really adding. There haven't been any prospective randomized trials. And at least on the surface, some of these combinations, the additional agents added, there perhaps is some question as to how much efficacy they are really providing. So what we sought to do in this study was to combine a more intense multi-agent chemotherapy regimen, dose-adjusted EPOCH, which has historically been used for high-grade lymphomas. And we have a single institutional experience now studying this in the frontline setting for ALL, but we wanted to test this in combination with inotuzumab ozogamicin to see what kind of dose of inotuzumab ozogamicin we could give safely with this chemotherapy combination, to look at the toxicity profile, but then also to get a sense of the efficacy, how the response rate and survival. So what we've observed so far, we've treated 18 patients with this combination. Fortunately, in terms of toxicity, the side effect profile has been quite manageable. There have been some dose-limiting toxicities, but they're generally fairly diverse. There hasn't been a really strong signal of safety with any particular toxicity, notably because of the risk of sinusoidal obstructive syndrome with inotuzumab ozogamicin. We've only seen one case of that in a patient who received a myeloablative transplant after participating in the study. So thus far, we've been able to escalate the dose up to our top dose level. We're still trying to understand the optimal dose. Toxicities, again, otherwise have been largely what you might expect. And then in terms of response rates, I would say this is where there's more excitement. All but one patient has achieved a morphologic remission of patients who had at least 5% blasts in their marrow, so a CR/CRI rate of 93%. And most of those are MRD negative by flow cytometry. We've even seen some MRD negative remissions by high throughput sequencing using the clonoSEQ assay. So overall, preliminary results suggest that this combination is safe and can yield response rates that are very high, arguably the highest we've seen, at least on an intent to treat basis, of patients treated in this setting. So we're going to be continuing to enroll, and hopefully down the road, we'll be reporting some updates.